The coronavirus truthers, as we call them, have taken up this line about the virus. That, oh, actually, I know that the obituary pages are full and no one can buy a sympathy card, but it's not that deadly and dangerous. Even as the death toll in America continues to climb past 60,000, 2,000 new deaths a day after day after day. And every day brings new evidence of how absurd those very claims are. So the New York Times, citing CDC data, now reports that the U.S. death toll is actually far higher than what's been reported. Now, people, of course, in America and everywhere, they die of all sorts of things every day in this country, from flu to cancer, heart attacks, homicides, driving accidents, suicide. And states and cities collect all that data, called all-cause mortality, right, to calculate the total number of deaths. So one way we can get a sense of how hard states have been hit by deaths from the coronavirus is just by looking at those current overall mortality tolls and comparing it to the same period of time, say, last year. That's exactly what the Times did. And lo and behold, they found excess deaths everywhere they looked. Now, some of them were positively reported coronavirus deaths, and others, many others, were not, though they were likely due to the virus. But each state they looked at has a huge spike. And crucially, it is even bigger than what you would see if you just took into account the reported coronavirus deaths, right? So look at New York City. Those gray lines at the bottom are total deaths in the previous 5 years. The red line is this year. The overall death rate just shot up so dramatically. If you were looking at that chart and it wasn't even labeled, you'd say, what happened there in March? And just about every chart shows the same thing. Here's New Jersey and Michigan and Massachusetts and Illinois. They all have this huge spike, that red line in deaths, again, represented there when you compare this year to previous years. And guess what? The evidence from across the world tells the exact same story. The Financial Times, using the same approach, right? All-cause mortality, found that global coronavirus deaths could be 60% higher than reported. The death rate in Belgium, for instance, is 60% higher than the historical average this time of year. In Spain, it is more than 50% higher than average this time of year. In hard-hit Italy, the death rate is 90% higher than in years past. We are seeing this everywhere. And it's a good illustration of why coronavirus trutherism is not just so dangerous, but also so deranged. I'm joined now by Dr. George Q. Daly, the Dean of Harvard Medical School, who co-wrote an opinion piece in the Washington Post urging Americans to beware of studies claiming COVID-19 death rates are smaller than expected. And maybe we can start, Doctor, sort of in the broadest possible way, which is, in terms of 2 months ago, how scientists were dealing with this new virus and how deadly they thought this was, and 2 months later, after the ravages, how did those sort of expectations and the data line up?
Well, I think based on what we knew 2 months ago, we knew this was a highly contagious virus. And the early results out of China suggested that a shockingly large percentage of infected patients were dying, maybe as much as 3%, maybe 6%. And now 2 months later, we realize that some of the hotspots, Italy, New York City, and beyond, have suffered a just astounding burden of death. Now, we don't know the underlying complete percentage of individuals who've seen the virus. And that's why these recent surveys, these antibody surveys, are allowing us to reassess the actual case mortality rate. But even as we've reassessed it down, because we appreciate that many more people are actually have seen the virus than are being counted, the rates are still quite staggering. The burden is very great.
This point is a really crucial one. So this sort of sets up this debate right now. And it sort of mixes together a good faith debate among experts and the data and a sort of bad faith attempt, I think, to do some sort of bait and switch. So the good faith version of this is we know how many cases there are that are confirmed. We don't know how many people have been infected, which is a much larger number. And if the multiple is big enough, if it's actually 100 times what we know of the actual cases, then actually the disease is not as deadly as we thought. You're arguing that the idea, the bullish case that like everybody's had it and it's 100 times, it's just not really being borne out by what we know. Is that sort of the argument here?
Yeah, this is what I am deeply, deeply and profoundly concerned about, is the overinterpretation that some of these early studies that suggest that maybe tenfold, or even in some reports, 80-fold as many people have actually seen the virus, that this is being used to suggest, oh, this is not a devastatingly fatal or virulent disease. But let's anchor it on what we see. In the major cities that have been hit, whether it's in the north of Italy or Wuhan, China, or New York City, our intensive care units have been overwhelmed with virus. Even in the worst flu years, we don't see this rapidity of death. We don't see the bodies piling up in morgues that can't handle them. This is far worse than flu. And we have to be careful as we interpret these early assessments of the percent of people in our communities that have seen the virus. We have to be careful that we don't reopen the economy too early, because we will provoke a second wave of epidemic. We will provoke an increased number of infections. And behind it, we will see the deaths start to mount.
Yeah, that is the big fear, the one that we're all trying to avoid. Dr. George Q. Daly, thank you so much for making time tonight and explaining that. I really appreciate it.